an employer is saying that he or she cannot find it in their conscience in terms of practicing their religion, that they cannot pay for a plan or have a plan that allows for or requires provision of abortion-patient drugs, and they therefore do not provide that plan. Just clarify for me, do they pay the $2,000 tax for not having it, or do they pay the $3,000 tax for having a plan that's in violation?
There is no penalty attached to the provision of preventive care. There certainly are penalties for employers who don't comply with the law. There also is no abortifacient drug that is part of the FDA-approved contraception. What the rule for preventive care...
Ma'am, that's not true.
Well, the scientists...
Is a morning after pill or something like that an abortifacient drug?
That is
yes
true.
Or no?
It is a contraceptive drug, not an abortifacient.
Yes or no? Yes or no? Does it?
It is not an abortifacient. It does not interfere with a pregnancy. If the morning after pill were taken and a female were pregnant, the pregnancy is not interrupted. That's the
your
definition
interpretation.
of abortifacient.
And I appreciate that's your interpretation.
That's what the scientists and doctors
We're not talking
me,
about
and
scientists.
I know you're
Ma'am, we're not talking about scientists here. We're talking about religious belief.
I'm telling you that...
Ma'am, I'm asking you about a religious belief.
Definition of an abortifacient.
In a religious belief, that is a violation of a religious belief based upon those within a religion. Now, let me expand on that then. So if an employer says, I cannot have this plan provided for by the employer, whether it's paid for directly or someone says it's going to pay for by somebody else, do they end up paying the $2,000 tax or the $3,000 tax per employee?
The rule which we intend to promulgate in the near future around implementation will require insurance companies, not a religious employer, but an insurance company, to provide coverage for contraceptives for employees who choose to access that.
Ma'am, that's not what I'm asking about. Ma'am, please, I'm not asking about that. This is very important. This is a First Amendment issue, which you keep talking about these things in a different way. Let me try and help make this clear. Because one of the things I think you say is that if an organization has people within that organization that are not part of that same faith value system, that they therefore couldn't claim an exemption. Am I correct in that? So let's say Catholic Charities has other employees who are not Catholic, or a Jewish hospital may have other doctors who are not Jewish, or Catholic Charities may provide services to non-Catholics, that they therefore could not claim a religious exemption. Is that accurate?
They don't fall under the definition that is total exemption from the rule. They will fall under the secondary rule of a religious objection to the service. But
under that, they would still have to provide the objectionable medical services.
Absolutely not. The religious employer who objects to contraception because of religious beliefs will not provide, will not pay for, will not refer employees to an objectionable service. On the other hand, the insurance company will provide the service to employees.
Let me make sure I understand this correctly. So if a child in school
upholds religious liberty and it makes sure that women have access to this benefit.
No, you're wrong. You're wrong for this reason. You know, you're setting up a rule that not even Jesus and his apostles could adhere to. Jesus was Jewish. He recruited Jewish people, tax collectors, sinners, Mary Magdalene and others, and therefore saying, you know what, because you're not bringing all Christians into this fold, you can't do this. What you're missing here is because someone else is paying for it, somehow that makes sense. If I go to a tire store, which I recently did, it was buy 3, get 1 free tires, I know I'm paying for that extra tire by the other 3 being pumped up, or someone else is paying for it by their costs going up somewhere else. It is one thing. I've searched for ways of trying to help you understand it, and I don't know, maybe the administration just refuses to understand, so therefore it can't happen. Whether or not you have someone else pay for it, or whether something else is under the guise of being free, as long as it is imposed upon someone to have this available, that is still a violation of their faith, which gets into the First Amendment. I don't understand why this isn't clear.
Well, first of all, I think that the tire analogy is not quite accurate. Insurance
Well, who's
is
going to
about
pay for
a balance of
who's
risk,
going to pay for the service?
providing, we know, because it was done in the Federal Employee
Who pays
Health
for it?
Benefit
Who pays
Plan.
for it? There's no such thing as a free
The
service.
reduction in a number of pregnancies compensates for the cost of contraception. The overall plan,
So by
according
not
to the National
having
Business
babies
Group on Health,
born,
goes
we're
down,
saving
not
money.
up.
I just want to get this on the record, Mr. Chairman. So you're saying by not having babies born, we're going to save money in health care?
Providing contraception as a critical preventive health benefit for women and for their children reduces health.
Not having babies born is a critical benefit. This is absolutely amazing to me. I yield back.
Family planning is a critical health benefit for women
you said
across
avoiding
this
pregnancy.
country, according to the Institute of Medicine, and that's, again,
I think that's
scientists.
it's about religious freedom.